Basically, the endoscopic ultrasound procedure is we use an endoscope which has an ultrasound probe at the tip. Now, this procedure is meant to visualize structures such as the pancreas, gallbladder, bile duct, and the liver. What makes it more difficult than the other regular endoscopic procedures are we are working in a limited space. And the challenge with endoscopic ultrasound is trying to maintain the orientation as well as trying to interpret the anatomy on an ultrasound image. The additional challenge comes when you're performing therapeutic procedures such as EUS-guided fine needle biopsies. The endoscopic ultrasound is highly precise and it can pick up even small abnormalities that can be missed on CT imaging. The other advantage of endoscopic ultrasound is because it allows us to perform biopsies so that we can obtain tissue diagnosis to diagnose if a patient has underlying cancer or not.
Today I learned a lot. Before I just learned in the lecture about this procedure, but now I came to observe with a real-time patient to improve my knowledge.
I hope so in future when we have more people and we can teach to next generation to know about EUS, and I think shortly we can perform it clearly and add one procedure to help our patient and to help our next generation.
After participating in today's sessions, I'm looking forward to the future of operations. I can come here for more training, gaining the knowledge from your experienced doctor in here.